My cousin is a nurse out in Boston and working on the COVID floor, so I heard her horror stories and the loss that she was suffering in her work. And I had friends in New York who've had it pretty badly, so I knew their personal experiences. It wasn't something that I wanted to get, but it happened. So I don't know that I would consider myself fearful, and I don't think I did prior to my diagnosis either. It was just something that is now a part of life, and that was my experience with prior to my diagnosis. So I work in public health, and so I'm deemed essential. So we've been going to work every day since everything started. We definitely changed the way that we operated, and our office is closed to the public, but I was coming in and doing mostly phone interviews and seeing clients through Zoom and things like that. And we were taking precautions, wiping everything down constantly, and wearing masks everywhere. And Friday the 8th, I came into work, and it just felt a little funny. I had tightness in my chest, not any difficulty breathing, but just kind of right underneath my sternum, it just felt tight. And I was thinking, that seems odd. So I called the doctor, and they said, come in. And I got tested maybe 40 minutes later. They were like, oh, you'll probably know by Monday. We'll let you know. I've tested so many people, and none of the people I've tested has been positive, so you're probably fine. So I went home and I isolated. I called my boss that I wasn't coming back to work. And I went home, and the next day I was feeling really well, and wouldn't have gotten tested if I was feeling the way that I was on Saturday. So luckily I had gone for the test. But I mowed my lawn and put my garden in and hung out in the sun, and did that on Sunday too. And on Sunday afternoon, I get a call from Population Health, and this wonderful nurse, Maria, called me, and we chatted about my symptoms and how I was feeling. And then at the end of the conversation, she said, so we did get your results and you're positive. And I was shocked. And so then I think I put it on Facebook that I was positive, and I was getting all these calls and all these messages. And my one friend in New York who had it really, really bad, she's messaged me and given me all the details about what she went through. And I freaked out. I was like crying and like, what am I going to do? I live by myself and no one can take care of me. And, what's going to happen if I can't breathe in the middle of the night? It was really scary. But yeah, and then the next day, Carissa called me, and we had maybe a 40-minute conversation and did the contact tracing and went through all the people, which, like I said, was really easy to do because I've been socially isolating as much as I can, and so it was really easy. I mean, the whole point is to give other people peace of mind about whether or not they need to be concerned about what they may have come in contact with. But it gives people control and power to take it on for themselves and take care of their own health. And if you don't let people know that you have been in touch with them and you're now positive, that's very unfair. So, and there was she didn't make me feel guilty or, oh, you shouldn't have had dinner with that person. There was just like, okay, you could tell she was writing it down, and it was easy. I mean, like I said, Carissa's very kind and friendly, and it was an easy conversation. It was like chatting with a friend. It didn't feel invasive at all.